Hey y'all, welcome back to my channel. Today is the 25th of June 2025 and it's been almost 2 months since I've had the double jaw surgery. We're actually just 4 days shy away from my 2 month mark. But because we are going to be traveling to Thailand in 3 days, I won't be able to make a video. So I thought I'd make a quick video now just to kind of show you where we're at 2 month mark. And as you can probably already tell from the title of this video, you can see that I got my braces taken off. So I'll show you real quick. And things are looking good. Took a really long time to get here, it feels like. And so much had happened since the last 2 weeks since I posted a video on my 6 weeks updates on my double jaw surgery. I'm feeling much better now than I did even just 2 weeks ago. And just quickly before we get started, I got these retainer that were given to me by the orthodontist. Basically, I'm gonna have to wear these. He say it's a full time wearing them. So basically, supposed to be wearing this for 23 hours a day. The only time I'm taking it off is supposed to be when I'm brushing my teeth and when I'm eating. So right now, I'm gonna pop them on. I talk a little bit funny with this thing on, so just a heads up for the rest of the video. I'll try to do them with these thing on. So here we go, y'all. The first piece is going on. I don't know why I was struggling. They're not that hard to put on, really. They do cause a little bit of pain when I put them on, and especially when I take them off because they're still fairly new and they're pretty tight. And yeah, that's about it. They're not that noticeable. So now that I got the retainers on, this is what I sound like. And it's not too bad in terms of the feelings. Like I've been wearing them all day and I barely noticed that I had them on. I used to when I had braces on when I was younger. I had these like expander, and they were very uncomfortable to wear. And at some point, I think as a child, I just kind of stopped wearing them because I was drooling all the time. I couldn't swallow. I couldn't really breathe. So yeah, that happened. In terms of how the recovery is going, things are good. The swelling is still coming down, and I can still feel numb on the bottom of my face, and over here still feel a little bit puffy. The I'm able to breathe a lot better now. Actually, the deviated symptom on my left side is coming down, and I can breathe a lot better now. I can now open my mouth just a little bit wider than 2 weeks ago, so I can basically fit two fingers in my mouth. Nothing weird. So kind of barely fitting two fingers in there, which is good. Right now, I talked to the surgeon and he said try to exercise every day, and the goal is to get three fingers in there. So we'll see how that goes. My jaw feels a lot stronger now. I'm able to chew more food. The other night, I was able to sneak in some steak. I just had to cut it really small for it to fit, and I just barely had to chew it. So, yeah, I'm starting eating steak now. I had pulled pork and poutine for lunch today. I still prefer mashed potatoes. Um, yeah, but overall, in terms of diet, like I'd say my diet is about 80% to normal now. I can't bite into like an apple or eating like a taco or anything that require me to tear the food off of my mouth yet. But I'm hoping sometime soon I'll be able to do that. All right, gee, it's quite difficult to talk with the retainers on, if I'm being honest. I'm hoping I could get used to them soon. Yeah, it's weird. To my surprise, I did not expect braces to come off this early. Normally, from what I've seen from other videos that I look at, people usually get them off at about around 6 month to a year mark. However, in my case, the surgeon didn't want to do any work on my mouth until my teeth were basically good to go. So I had braces on for exactly 4 years and 2 weeks. So that gave me a lot of time to kind of straighten out my teeth and put them where they need to be. And then when the surgeon did his work, all you have to do is just move the jaw, the bottom one back, the top forward, and things were already lining up for me. In terms of exercise, I started going back to the gym as of last week. So at about 7 week marks, I started going back to the gym, lifting weight. So I'm not doing any big lifts or anything like that. I'm not doing anything much of not much of compound movement. So anything like squat, deadlift, or even bench press. I'm not doing too much of that, if at all. Most of the workout that I'm doing just mostly been like isolating workout. The way the surgeon put it is that you don't want to do any exercise that require you to use kind of your whole body and involve a lot of your core, because I'm still at a risk of blood clot. And yeah, ideally I would not like to get that right before we go to Thailand. So I'm back to cycling now. I'm not doing any crazy kilometers on the bike. Just more like leisurely ride down to like a farm, get some slushy, and then come home kind of thing. So things been good. But in the next month, I'm planning a bike trip to ride about 170, 180K. So hopefully by next month, I'll be good to go for that. Boxing, I really miss boxing. Um, Unfortunately, basically, the surgeon doesn't want me back in the ring getting hit until the next year, which is still over half a year away. But I'll probably do some pad work and hitting bags and stuff like that. Those should be good to go sometime soon. Skipping rope. I love skipping rope, and I'm still skipping rope most day of the week. And that's been really good. No problem skipping rope at all. And my voice is slowly coming back. I think right after surgery, I felt like my voice was a little bit croaky. It's hard to explain, but it's that I had that voice of like somebody who vaped for a long time, and yeah, now I'm able to like pick up the guitar and sing to it and kind of enjoy it a little bit. So in the last couple of weeks, I've had a couple of people ask me why did I need to get a jaw surgery. I guess they didn't meet me before I had braces on, or even after the surgery. So I asked for my pictures that was taken at the clinic before I put on my braces on. So I'll put it up right here, and we'll talk about it. So here are some pictures of my face and my teeth. Let's start from the top left. You can see that my bottom jaw is protruding past the top of my face. And the second picture is in. That's basically how I looked before. I look very young. That was 4 years ago. And on the third one, that is what I look like with a smile on. Now, if you look at the bottom three pictures, from the left side, you can see my underbite, how the lower jaw is protruding past my top jaw. And if you look just one picture to the right, you can see my teeth in front were falling over due to the crowding that I had. So that is why I need braces and the surgery. And things are starting to go back to normal. Just about 2 weeks ago, I went back to my cousin's wedding in Toronto, and it was great, beautiful wedding. I didn't have any pain in my face. I was able to enjoy and be in the moment. So I couldn't really eat the food there, but I knew what I was walking into. So I did go to Booster Juice, and I just kind of filled myself up before I went to the wedding. Now with that, I think I'm going to wrap up the video here. I just want to show you the new look. Now without the braces on, I'm very happy with it. It took a lot of work to get here, a lot of time. Um, like I said, the physical part wasn't too bad. Like the pain wasn't bad. The discomfort was like, yeah, whatever. But the hardest part of this, I would say, was the mental side of it. It took a lot of mental toll on me since after the surgery. But I will say that so far it is worth it. So if you are looking to get it done, I highly encourage you to do so. Yeah.